Thank you. It's really an honor to be here, so thank you for having me. So we could just go to the first slide of the presentation. Yes, so good afternoon. Again, my name is Paige Stringer. I'm the founder and executive director of the Global Foundation for Children with Hearing Loss. And our organization works with partners in low resource countries to help establish the services and the expertise that children 0 to 6 years of age with hearing loss need to listen, talk, and thrive. And so today I'm going to be talking a little bit about our work in low resource countries, drawing on the experiences that we've had over the last decade. Next slide. I thought it would be helpful to start with a reminder of the continuum of care that is required for babies and young children with hearing loss to successfully learn to listen and speak. It starts with early identification of hearing loss proactively through hearing screening programs. Then families of children identified with hearing issues need to be educated about hearing loss and provided with guidance on the way forward. The child needs to be fit with appropriate hearing technology in the way of hearing aids and cochlear implants. Then they need to have access to locally based rehabilitation professionals to make use of that hearing technology and develop listening and spoken language skills. All of these steps are equally important to successful outcomes. Unfortunately, in many low and middle income countries, some or all of these elements are missing or fragmented, which is negatively impacting hundreds of children. Next slide. So this slide lists some of the challenges of cochlear implants that the Global Foundation has witnessed over time among the families that we have worked with. First off, as Eddie mentioned, the expensive upfront cost. And governments and health insurance plans in these countries usually do not cover the cost of cochlear implants and everything that comes with it. Thus, parents who want for their deaf child to hear and speak often take drastic measures. They sell their land, they take out huge bank loans, they borrow extensively from friends and family to cover the cost of the initial surgery and device. The challenge is that initial surgery and device is just the beginning. The ongoing lifelong costs associated with cochlear implant maintenance, repairs, upgrades, mapping appointments, therapy appointments, so forth, are not well communicated up front. And too often, many families become burdened by these ongoing expenses and makes it very challenging for the family to thrive. Another challenge is that children in low resource countries are often provided with just one cochlear implant processor. So if that processor breaks or needs repair, it can be extremely difficult to get a temporary replacement. And that often means that the child is off the air for extended periods and thus losing precious time in their development. And sometimes parents are provided with misinformation or have misconceptions about what a cochlear implant can do for their child. They think of the cochlear implant as a sort of magic pill. They mistakenly believe that once they get the device for their child, he or she will immediately be able to hear and speak. And we all know that that's not the reality. So they are disappointed to later find out that that's not the case, and there's actually an investment of therapy that's required. Other times we witness the parent of a 15-year-old child, for example, who wants dearly for their child to hear and speak and moves quickly ahead with cochlear implant surgery without anyone counseling the family that it's too late for the desired outcome because that child is 15 years old and it's much too late for them to benefit from the cochlear implant. We have seen healthcare systems invest heavily in the surgical aspect of cochlear implants without addressing the essential rehabilitation needs. As a result, there are not enough locally based trained professionals to provide mapping and therapy support for the children after they are implanted. Further, lack of awareness can lead to discrimination and stigma against children with cochlear implants among teachers and the community at large. So all of these issues are barriers that lead to poor outcomes for everyone involved, especially the children. So next slide. These are just a few of our ideas for potential solutions. So recognizing that there is a cost associated with the research, development, and manufacturing of cochlear implants, we still think it would be wonderful if we could encourage the companies to develop a strategy to make low-cost cochlear implants more accessible and more fully supported in low-resource countries. Or how about making refurbished cochlear implant processors available, just as they are for hearing aids? So every 5 years, when our processors are upgraded, it's on an opportunity when those that are still in working order could then be shared with families that are less fortunate. There also needs to be better communication between the companies and the surgeons and hospital leadership in these countries about the rehabilitation requirements that these young children need. Children should not be implanted until appropriate and locally based audiology and therapy services are established first. Patient counseling needs to be strengthened so that families are informed in advance of the financial and time commitments involved with cochlear implants, just as Eddie was describing before, so that they are well aware of the investment and they can make appropriate decisions. More education is also needed for government agencies about the benefits of cochlear implants and how investment in the entire continuum of care can help to reduce the burden on the individual, the family, the community, and society. This knowledge could lead to more equitable and sustainable access to cochlear implants, more financial assistance for families, as well as increased professional expertise to support them. And outreach efforts are also needed in the community to raise awareness about how cochlear implants and early intervention have expanded possibilities for deaf children today. So next slide, please. So the Global Foundation for
Paige,
Children
you have
with
about
Hearing
1 minute.
I'm sorry?
You have about 1 minute, Paige.
Oh, okay.
Yes.
Okay. The Global Foundation for Children with Hearing Loss has worked to address some of these challenges in Vietnam. We spent 10 years in Vietnam training Vietnamese medical and educational professionals and providing a family education. We helped to build the foundation of services across the country that young children with hearing loss need to listen and speak. Then, in 2017, we entered into a collaboration with Hear the World Foundation. 10 young children in Vietnam received donations of cochlear implants and associated surgery, but the donation didn't stop there. They also received 15 years of complimentary processor upgrades, repairs, and mapping services. They also received 3 years of complimentary auditory verbal therapy services from Vietnamese professionals that have been trained by the Global Foundation. So this donation made a cochlear implant financially accessible to the families and helped to complete the continuum of care that these young children needed to learn to listen and talk. And all 10 of these children are now doing really well. They're in mainstream schools, and they're really examples of success for the country, helping to lower some of those barriers and stigma that exist in the country. So more initiatives like this would really help to raise awareness and inspire change and give hope to families in low-resource countries. Next slide. So one suggestion, just thinking about our forum and the great people that we have brought together today, just wanted to bring up one suggestion that perhaps we could talk about later, is whether we could collectively develop a comprehensive guide that would be for government agencies, hospitals, advocates, and others looking to establish cochlear implant programs in their countries. And we could approach the WHO perhaps about possibly endorsing this guide. And it would be a roadmap for low-resource countries to give them the information and the tools they need to make the right decision and discuss the multiple and complex elements, some of which I discussed today, that need to be addressed to ensure successful pediatric cochlear implant programs.
Wow.
So thank you.
Wow. Wow. Thank you so very much. Brian, I would say that in the interest of time, we would have, if there is one question that you want Paige to respond to.
Yeah, Paige, thank you. That was incredibly inspiring, and we'll definitely take away your suggestion of what CIICA could do next.
Right.
I'm just wondering very quickly, in terms of those different strategies you put up there, in terms of doing things within countries that have low income, what do you think is like the one biggest thing that could make the difference?
The one thing that would make the most difference. So I think, again, focusing on the whole continuum of care. I mean, Eddie touched on the financial challenge. That's a huge barrier, the cost of cochlear implants. But then also putting that in the framework of the entire continuum of care. Because even if the cochlear implants are made available, but there's nothing else to support the children afterwards, that's not effective either. So we need to come at it in a systematic